So some of the dental emergencies can be a broken tooth, pain, swelling in the head and neck. It could be a crown coming off, a filling coming out of your mouth, bleeding in your mouth, falling, getting a cut on your lip or your tongue. So the best thing is to give us a call so we can ask you some questions over the phone, assess the situation, and most likely get you in for a visit. So when you would see a dentist is really when you have a broken tooth or your crown comes off or a temporary crown comes off. If you fall and you have lacerations, cuts, broken jaw, or you can't open your mouth, things like that, a lot of times most patients will call the dentist and we ask you these questions over the phone. If you have a cut on your face or your lip that is open, that is a situation that typically we would tell you to go to the emergency department. If you have swelling that is getting in the way of your breathing, that is something you have to go to the emergency department. But anything that is related to a single tooth or a cracked tooth or a filling coming out, crown coming off, any sharp pain that you have when you're chewing, those are things that you would call your dentist about. Common dental emergencies we see is patients breaking teeth. A lot of times if their front tooth chips or breaks, they give us a call. Other things, their crowns come off, temporary crowns come off. They have pain a lot of times, whether it's chewing or with hot or cold sensitivity. Other things that we have usually is going to be things with their kids. If their kids fall and they have a tooth that kind of goes inside, they do give us a call. So those are some of the common things we see. Emergency dental extractions typically are when you've got swelling that can affect your airway, you've got infection, you've got pus and things like that coming out. If you can't open your mouth, broken teeth that are causing infections typically are the times when you come in to get an emergency extraction. Emergency root canals are typically going to happen when an infection occurs in the tooth. Typically that happens when you have a cavity that is so big and it's gone untreated. Basically what happens is the bacteria gets inside the tooth and it kind of forms like a bacteria factory in there, and the factory just produces bacteria. So what it does is a lot of times it will be entrapped inside the jawbone and it has nowhere to go. So the bacteria causes all these gases, which causes severe pain and discomfort, or a lot of swelling, and therefore we need to see you to do an emergency root canal treatment. Yes, typically we do schedule time in our schedule to see patients right away, especially if they're in pain and discomfort. And we try to, at a minimum, get them out of their pain. Yes, so we do offer later hours in our schedule. We see patients twice a week, up to 6:37. We have patients, our scheduled hours are from 7 to 7, depending on the days that patients request to come in. I hope I've answered any of your questions you may have had. If you do have other questions, please give us a call at 571-248-0700, and we'd be happy to take care of you.